Hi, good morning, everybody. We're starting the morning off talking about health. So hopefully everyone slept well last night. I did not sleep well last night. So if I fumble, that's why, but I can actually talk about certain aspects of sleep. If you know me or if you know my company, Learn Adapt Builds, one of the things that we really tackle is health in the workplace. And the biggest thing about that is decreasing burnout. So worldwide, we're seeing rising burnout rates. And in certain countries, it's a lot more dangerous than other places. A lot of these countries where it is hitting dangerous levels are places that don't diagnose burnout. So there's a lot of countries that do, mostly in Europe, and there's a lot of countries that don't. And I burned out in the US, which certainly does not diagnose burnout, but they do see it as signs. So I just recently spoke at a conference where someone came up to me quite upset afterwards, having realized that they were in the US and got diagnosed with chronic anxiety disorder, which they said they would have for the rest of their lives. And unfortunately, that person probably just had burnout and realized that. So what we're looking at with burnout is a couple of things. To burnout, you have different aspects like sleep, which I didn't have enough of, anxiety, and aspects of control. So I'm going to talk about these, and I'm going to deviate a little bit from kind of the topics I usually talk about because we've had an amazing fall and lots of conferences with new research studies and new outputs. If you know our company, Learn Adapt Build, we do assessments of workplaces. And we always start, like our name says, by learning. We figure out what's going on with the environment or the people or the different subcultures within there. And we try to improve them and improve things for people. So I had a conference yesterday where we talked about the #1 complaint in offices, and we had done some great scientific research on it, where we looked at sound and cognitive performance. So a lot of people complain about sound, pretty much across the board, very different profiles, that kind of thing, and it is a huge problem. And this has been happening probably before open offices plans, but certainly a lot more since open office plans. And so I decided to do a research study and look at the different sound options and resolutions for that. And I said, this is great. We can prove that sound is terrible for cognitive function and we should have quieter spaces or different things. So we set up this experiment where we had a silent area where they would do a cognitive test, 3 cognitive tests actually, and then we measured their biology, so their heart rates, the different biometrics. We had white noise mixed with offices, so kind of that dull blurring where it kind of hums and erases the variance in sound. We had soundscaping, which is a bit popular right now. We're seeing that soundscaping is coming up as a solution for sound. And I think it's so funny to see that that resolutions for sound are also sound. So soundscaping is this situation where when there's sound in the office, you have a babbling brook and sometimes maybe even a video of a babbling brook, where it's supposed to be relaxing to people, but also drown out the sound. So we had a babbling brook in the experimental situation, silence and white noise. And so we looked at all of these different sound options and we had them go through some cognitive tests. We had them do some surveys to look at how they experience the different situations. And this is my joke. Like all good Facebook relationships, the answer is it's complicated. So I don't know if you guys laughed, but I might start explaining my jokes with the fear that you guys aren't laughing. So sound is really complicated. Past literature has found that some things work better than others, and that's what we found in our study. we found altogether that people really do not enjoy anything but silence. And something that might be the reason for this is because it was very much a test. We're all, as we go through the educational system, we're all challenged, and we're taught that we should be in silence. The other part of it is profiles. There are people in offices that are extremely sensitive to noise and cannot concentrate. And so we're having these situations where we're really having usually introverts and sound sensitive introverts do very poorly in open workspaces. And then we have people who are extroverted, who do better with this kind of thing, who are exceeding in workplaces. So I feel like one of the questions we need to ask is, what are we going to do about introverts in the workplace? Because we have a system where morning people are benefited from modern workplaces. We have a situation where extroverts are benefited from modern workplaces, and we have open offices that are very loud. So one of the things we did in one of our other studies is that we created small rooms where people could go into and have focus area. And we thought, this is great. Introverts will go into the small offices and be able to work, and they'll have quiet, and they'll have some restorative time, and they won't get so exhausted. The unfortunate thing is that introverts are often not morning people. Their chronotypes are later in the day. And so what we had is a bunch of extroverts coming into these small working places, getting a couple hours of intense work done, and then coming out because they're extroverts and they want to socialize, and coming out and talking in the open office areas. So it didn't work out in that experiment. And the sound experiment also didn't work out. We saw that there was quite a lot of differences between different profiles. So there's no clear answer of what works for sound. Past research studies have shown that music can get us into work really, really well, but then we should actually put the music down as soon as we've entered what they call workflow, where we're really getting a lot of work done and we're in a deep focus. Soundscaping is funny. It's a great solution, but one thing that scientists are finding is that some of the sounds are found to be really, really annoying. The babbling brook, in a few studies that I've seen, has been an annoying sound to have in the background, which is counterintuitive because a lot of people think, oh, it'll be so soothing. It's like biophilia in the office. That'll be a really restorative thing. And the other side effect, which is really interesting, is that it makes people feel like they have to pee. The babbling brook, people constantly respond that they go to the restroom more. And it's very distracting. And in a world where we have so many meetings back to back and so much to do, going to the restroom every hour is quite distracting. So soundscaping has shown in some studies that it does improve your cognitive abilities and your abilities to do that if you don't have to pee. So that's one of the studies that we're working on. The other study that we presented this fall at a conference was burnout and sleep. We were looking at the sleep dimensions, and sleep is an incredibly powerful tool for restoration. It's when our brain restores, it's when our body heals itself the best. It's this incredible time, and most of us are not getting enough sleep. And it's showing in our workplace trends, and it's doing that. So we did the longest burnout study on sleep that had ever been done with technology. A lot of times sleep studies are done in sleep laboratories. And I have a question. How is burnout rate measured in the country at the moment? For example, in some states like the US or Europe. Burnout is measured in the Netherlands, mostly using the Maslow burnout inventory. And so that will be an appointment with a doctor, and also an assessment where they ask you different questions about your level of energy, your feelings of depression, that sort of thing. And then you're diagnosed. in places that study burnout but don't diagnose burnout, like the US studies burnout like crazy, but they can't diagnose it. So uh, doctors recognize it as a problem, kind of like a social disorder, not a social disorder, a social problem like anxiety, or it's coupled with that, or heart arrhythmia, if you have problems with your heart and you're headed towards a heart attack. So usually when a doctor recognizes something that is burnout by the terms of the Netherlands or countries like that, then in the US, it's either you're headed towards a heart attack or you have chronic anxiety. So then you have countries like Japan, where they recognize something called karoshi, which is a word meaning death from overwork. And the reason that this word came about was that Japan had pretty consistent situations of death. So one year they had 27 people die from overwork, kind of collapsing in the workplace or in the subway. And they needed a word to call this phenomenon. So that happened decades ago. And they finally had to come up with a name. And now they recognize every year the karoshi rate. So how many people died from death from overwork this year. And they report that publicly. So we have this sort of recognition of burnout globally, and the World Health Organization just recognized burnout as a disorder, as a disease, which was huge for the world. And hopefully different countries will start recognizing it and looking into solutions for how to tackle a disease that's killing people, but also just affecting many of us. A lot of people think of burnout as kind of hitting the wall, which it's called, but there's very much a gray scale of pre-burnout, and a lot of us are in that. We're getting too little sleep. We have high stressful jobs. A lot of us are walking around with the stress hormone cortisol in our body constantly. So the reason for that hormone is it's an ancient solution when there was danger, when we weren't going to have enough food, that kind of thing. Our cortisol would spike and we would do something about our situation to keep us safe or alive. Nowadays, it's also useful if we almost get hit by a bus. Our cortisol spikes, our heart races a little bit, and we are probably woken up a little bit and more aware. Unfortunately, now people are walking around with consistently high levels of cortisol. So always in a state of danger and not survival, and not for the right reasons. We have people who are stressed at their work because of the situation with their boss. We have people who are worried about different things with their family. And ironically, the technology that we have also creates cortisol in us. So those little numbers on your phone with the different apps actually create cortisol in us. And it creates amount of stress, and then it becomes a technology addiction, which we're seeing everywhere, of getting rid of those numbers, addressing those, and coming back. And while technology is addictive, it also makes us less happy. So there was quite a few studies done to show that our interaction with technology, while we're very much acting like addicts with it, people feel more depressed after looking at Facebook or addressing their technology than before. So technology is a huge aspect of something that we're looking at. It's something that's a solution, but it's not necessarily something that we should be around all day. And I'm a huge advocate for leaving our technology away from us after the workday. I know, no fun with it after work, but we're seeing people in Silicon Valley actually carefully monitoring their kids' use of their cell phones, their iPads, and that sort of thing, because they're aware of the technology use in and the problems with addiction and that kind of thing. So I think if we want to follow people in Silicon Valley who want something better for their kids. We should all be as lucky as Silicon Valley kids and give ourselves a break from this technology. Like I said before, we've had a pretty phenomenal fall. We've been talking at different conferences and looking at different research studies that we've done. Some of the studies that we have coming up, which I'm really excited about, look at things like diversity. Now, that's a very popular topic, but I actually mean diversity in all the ways. So one of the great things, we work with Edge quite a bit, and they have built a building where people are supposed to run into each other and meet each other, and not just in the same company, but within different companies. And the idea behind that is very much that people who run into people who are different come up with new ideas. So I worked at an advertising agency a long time ago that I burned out from, quite embarrassingly. I fell asleep during a bikini wax and realized that I had burned out from my job. But at that company, they had this great idea of pairing people who were opposites. So in advertising, an art director and a copywriter or writer work together. And so they would put people who were very OCD, very clean, very organized together with the kind of chaotic, maybe a little disorganized, smelly, wild spirit. And the first day would be awful, and then something magical would happen. They would realize that working with someone who had different ideas than they did actually produced some really great work. So the buildings that we're working on now are designed to have people run into each other that aren't the same, people who work in different companies, facilities, that sort of thing. And some of the research that we're working on with different universities actually suggests we shouldn't maybe sit with our team. So we should have a study that Harvard just came out with, and we're doing a follow-up with them, where they looked at the best outcome for team performance was not to sit with your team consistently, but to actually choose given times where you work intensely on a project together, and then you disperse and you can work on your own or work with other teams and that sort of thing. So I think this kind of circles back to sound as well. When you sit with your team, you have so much collaboration and, hey, Frank, did you see that email from so-and-so? Hey, and it can be very productive in some ways and useful, but it's constant distraction. And for people who are sensitive to sound or people who need to do deep work, which is pretty much all of us these days, it's very counterproductive. So we're suggesting to sitting with completely different people and to be able to sit by yourself in solitude. So that's kind of sound and that. And the other reason for that is while we're constantly connected to other people, we're seeing people get more and more isolated. And we really need to make the workplace, in some ways, a social place in the best way possible. To not make it a social place at desks, but to have social experiences where people connect and get those feel-good hormones from seeing someone smile. I teach a summer course and I bring my son there because the best thing in the world is to change someone's brain chemistry. So I always promise I'll increase your happy hormones at the end of this talk. And I bring my son in, and the whole room, which I've been trying to get to smile and engage the whole time, lights up. And we need that from other people. We see, especially in millennials, a huge disconnection from other people, a lot of depression and really high burnout rates. So that's about all I have time for. So I wanted to look into some questions if there are any, or to address anything, or to get any requests for future research that we're going to do with other companies. Like I said, we always do research before we do any sort of consultation on buildings or companies, and so we're always looking for new ideas for that. Is there any? Let me see. No. Okay, I think that's it. It's a little bit early, so hopefully everybody had a good morning, and I might go back to bed. But thank you so much for having me. I hope you enjoyed it as much as I did, and please stay tuned. We're going to keep doing incredible research and really pushing the workplace forward into new trends, and we hope that you do it as well, because we need to find a better way to work. Thank you.